brachioradialis muscle. The brachioradialis muscle is found on the anterior aspect of the arm and the forearm. Unlike the other elbow flexors, this muscle functions to prevent separation of the elbow joint during quick arm movements. Let's take a look at the landmarks for the brachioradialis. First, we have the humerus, and the radius, and the ulna. In green, you'll see the origin of the brachioradialis located on the lateral supracondylar ridge of the distal humerus. And in purple, we have the insertion of the brachioradialis on the styloid process of the radius. Let's take a look at some attributes for the brachioradialis. Contraction of the brachioradialis produces elbow flexion with the forearm in a neutral position, so it's neither pronated or supinated. Some synergistic muscles include the biceps brachii and the brachialis, and the wrist extensors during gripping movements. And the triceps brachii serves as the antagonistic muscle for the brachioradialis. Here are the clinical findings for brachioradialis trigger points. Clients make a complaint of pain that starts at the lateral epicondyle and moves down to the wrist and to the base of the thumb. The therapist can actually confirm the presence of an active trigger point in the brachioradialis by tapping on the lateral epicondyle and eliciting pain and tenderness. Your client may also complain of pronounced weakness of the grip, with objects frequently slipping out of their grasp. Some activating factors for brachioradialis trigger points include playing tennis, weeding with a trowel, prolonged frisbee throwing, ironing, and prolonged immobilization after a shoulder injury. Some associated trigger points for the brachioradialis include the supinator, the wrist extensor group, and the medial head of the triceps brachii. Clients with active brachioradialis trigger points are commonly misdiagnosed with C5, C6 radiculopathy, lateral epicondylitis or tennis elbow, and carpal tunnel syndrome. To locate and release the brachioradialis trigger point, start with the client in the supine or seated position and locate the outside edge of the elbow crease, which you'll use as your landmark. With the client's hand held in a thumb up or neutral wrist position, the brachioradialis trigger point lies 1 to 2 inches distal or below the lateral end of the elbow crease, directly on the mound of muscle that gives shape to the upper forearm. This trigger point refers pain strongly to the lateral elbow and to the web of the thumb. Grasp your client's hand like you were going to shake it, and then apply pressure to the trigger point with the thumb of your other hand. While holding the pressure, gently ulnar deviate the client's wrist or rotate the pinky side down to stretch the brachioradialis muscle. At the end of the movement, briefly hold your pressure and then release. Return the client's hand to the starting position and repeat 5 times. Starting at the crease of the elbow, go to the lateral edge and move your contact down 1 to 2 inches. Right on the mound of muscle here is the brachioradialis trigger point. Turn your client's hand into the neutral position as if you're going to shake their hand. Apply pressure with your thumb as you bring the pinky towards the floor. Hold the pressure, then release. Again, apply the pressure, bring the pinky down and hold, and release and bring the hand back to the neutral position. Repeat this procedure 4 to 5 times. Here we have a close-up view of the stripping technique. Apply pressure with your thumb, and then stripping technique as you bring the pinky down to stretch the muscle fibers. Hold the pressure at the end, bring the wrist back to neutral, and repeat 4 times.